Hi everyone, welcome to another anatomy video. In today's episode, we're going to be looking at the lower limb bone landmarks. So basically the landmarks that are on your femur, tibia, fibula, and your feet. So please like and subscribe for more content in the future. And without further ado, let's get into the first bone structure, which is going to be your femur. So the first part that I want to go over is this region right over here. This is the head of the femur. So it's going to be this ball area where your ball and socket joint would be. Then you have your greater trochanter. The greater trochanter is this bigger projection up here at the top. So that is the greater trochanter. And then you also have a lesser trochanter, and the lesser trochanter is going to be the smaller projection that is here over the at the bottom area. So that is your lesser trochanter. Then in between the two of them on this image, you can kind of see this dotted line area over here. So this dotted line that is over there, that is going to be your intertrochanteric line. Intertrochanteric line. Right over there. And it basically is just separating the two of them. Then you have the shaft of the femur, obviously, and then we're going to take a look over here at the bottom of the femur. So the first part is your lateral epicondyle, which is this side projection over there. And it is the lateral one because it is on the lateral side. You can differentiate lateral versus medial sides because the medial side is going to be where the head of the femur is, aka where this little ball area is. So the ball is the lateral side. Therefore, we know that this projection over here on the other side is going to be your medial epicondyle. Now in blue, you'll see this little area over here. This is your patellar surface, and it's basically just going to be where your patella, aka your knee bone, is going to sit. So it sits right over here on the blue kind of cartilage looking area. Finally, you have your linea aspera, which is going to be on the back side of the femur. So these are both like front views, but the back side would basically kind of just look like this, and then this is the shaft area. Linea aspera is going to be this kind of rigid line that is running down the middle of the shaft. So that is your linea aspera. Then you also have your medial and lateral condyles. So your medial condyle is going to be over here on this side because the bone is turned on the posterior side, so the positions are going to be switched. So this is your medial condyle over here. And then on the other side would be where your lateral condyle is. And it would just be another projection that is over here on this side. Now you also have your fovea. The fovea is going to be this little indent that is on the head of the femur, and the full wording of this is the fovea capitis. And it's just this little indent. There is going to be a ligament that connects the fovea capitis to the other joints, so it's your ball and socket joint of your hip. So that is everything for the femur. The way you differentiate right versus left is basically you're going to line up the head within your hip region, And then the greater trochanter should be facing most laterally. And that's how you differentiate right versus left. Now we're going to take a look at the tibia and the fibulas. So the tibia is going to be this larger bone over here. That is your tibia. The first portion is your tibial tuberosity, which is this little bump over here right at the top surface of the tibia. So again, tibial tuberosity. Then you also have your articular tuberosity. Articular tuberosity is going to be on the side. So it's this little like area over here. You can see that it's a little bit more rough patched than the other smoother areas. And that is your articular tuberosity. There we go. Now, you also have your anterior crest. The anterior crest is just going to be this top region of the tibia. It's going to kind of come to a point, and that is why it is called the crest. Finally, on the very end of the tibia bone over here, you have your medial malleolus. The medial malleolus is going to be this little projection that is over here. This also helps you to differentiate the positioning of right versus left on the tibia because the medial malleolus will always be closer to the midline of your body or the inside of your leg. All right, now we're going to move on to the fibula. So the fibula, first portion over here up at the top, this is going to be your fibular head. So the fibular head right over there. Then we have the shaft. So the shaft is just like this whole region of the fibula. Then down at the bottom, you have your lateral malleolus. The lateral malleolus is going to be this side of your fibula. So when you are placing the tibia and the fibula together, basically you can kind of rearrange them based on where the medial malleolus of the tibia is and where the lateral malleolus of the fibula is. When you are differentiating right versus left, you are going to use this structure called the malleolar articular surface. The malleolar articular surface is basically going to be this groove on the fibula where your tibia is going to sit. And again, this is called the malleolar articular surface. So it basically looks like an indent within the bone. And imagine you are scooping up like a bowl of soup. So if you are able to scoop up the liquid or whatever in your right hand, then that means that that would be a right fibula. However, if there is like a piece of bone that is blocking that indent, if there is a piece of bone that is blocking the malleolar articular surface, then switch hands and see if you are able to scoop up with the other hand. And if you are, that means that that would then be a left fibula instead of a right one. So that is the way that I kind of differentiate right versus left. Finally, one last thing that is cool to know is that you see this kind of like gray membrane in between the tibia and fibula. This is known as your interosseous membrane, and it just helps to kind of glue the two bones together and help them to not really move around within your body. All right, finally, we're going to take a look at the foot. So the first thing is your calcaneus. The calcaneus is going to be this big bone structure here at the bottom, and it is basically known as your heel. So this is your heel bone. Then you have your talus. The talus is going to be this bone that is above the calcaneus, and it's just up here at the bridge of your foot. So that is your talus. Now you have your cuboid. The cuboid is going to be this cube looking bone right here next to everything. So that is your cuboid. It looks very square looking, so that helps to differentiate where it would be placed. All right, now you have your navicular. The navicular is up here at the very top, right over there. So in this side profile look, this would be your cuboid, this is your navicular up here, and then you have the three rest of the bones. So the three rest of the bones, those are called your cuneiforms. Cuneiforms. For now, you don't really need to know the names of all of these different cuneiforms. Just know that that group of three remaining bones is your cuneiforms. All right, so that is everything for the lower limb bones and their landmarks. I hope that you guys found this video informational. If you have any questions, comments, concerns, leave them in the comment section. If you would like some extra anatomy tutoring, I also offer that. So please comment down below if you would like that opportunity. And keep studying. You guys got this. And like and subscribe for more content in the future. And I'll see you in the next episode. Bye, and thank you so much for watching.